Dear viewers, when a government quietly slips a price tag onto illness, it isn't just changing a policy, it is rewriting the social contract, and Maharashtra has just done exactly that. Picture this: a woman waits outside a district hospital before sunrise, a cloth bag under her arm, reports folded carefully inside, hoping the doctor will see her before her daily wage job docks her pay. For years, this hospital was the last line of dignity she had left. No cash counter first, no payment before procedure slip shoved across the table. You were sick, you were treated. Simple, human. Now imagine the same woman being told politely that she needs 5 rupees for registration, 15 rupees for blood tests, 300 for a CT scan, 100 per day if she lands in the ICU, and 40,000 if her knee needs replacing. None of this sounds outrageous when you say it quickly. That's the trick. Death by 1,000 nominal charges. Hello, I'm Tejas and you're watching Honest Take on Lokmat Times. In this video, let's shed some light on the recent Maharashtra government decision to change fees at the government hospital, how it affects the poor and vulnerable of our society, and how the powerful people who do not even need government hospitals are exempt from paying the fees. But before we start, you know the drill. Please do subscribe to Lokmat Times if you haven't already and press the bell icon to never miss an update. Before we talk about the recent decision, let's first rewind to August 2023. The Maharashtra government stood up confidently and said something rare in Indian public policy. All services in public hospitals would be completely free. OPDs, lab tests, scans, surgeries, even PPP run services. The language was bold. Right to health, Article 21, a promise to 2.5 crore people who depend on government hospitals, not because they want to, but because they have no choice. It was projected as moral governance, as a statement that in this state, your survival would not depend on the thickness of your wallet. Now fast forward to January 16, 2026. A new government resolution lands quietly on a desk. No big press conference, no chest-thumping speeches, just a rate card. And with that rate card, the promise collapses. From now on, if you are an ordinary citizen, every single service in government hospital has a price. Registration, admission, tests, scans, dialysis, ICU beds, surgeries. The hospital hasn't changed. The doctors haven't changed. The patients haven't changed. Only the power equation has. And here is where it stops being just bad policy and starts looking like moral vandalism. Because while the farmer, the daily wager, the unemployed youth, the informal worker is asked to pay, a very specific group remains untouched. Government employees and their families, medical staff, students, prisoners, freedom fighters, and yes, MLAs, MPs, ministers, former legislators, and judges. Let that sink in. The same MPs and MLAs who do not set foot in government hospital unless a camera is following them. The same judges and ministers who are flown to private hospitals, admitted into premium rooms, treated by top specialists, all at public cost or reimbursed later. These people are guaranteed free treatment in government hospitals they do not use. Meanwhile, the man who actually sleeps on the hospital floor while his wife is in labor is asked to reach into his pocket. This isn't irony. This is hierarchy written in bureaucratic ink. Health activists have already pointed out the absurdity. Those protected by this exemption almost never use public hospitals. So why protect them at all? Because the exemption is not about healthcare. It is about privilege. It is a VIP stamp in a system that pretends neutrality. And before anyone says, but the charges are minimal, let's get brutally honest about how poverty works. User fees don't hit everyone equally. 5 rupees to you is nothing. 5 rupees to a daily wage worker is a calculation. 15 rupees today, another test tomorrow, another visit next week, bus fare both ways, and a day's wage lost each time. Suddenly, the illness is cheaper than the treatment. So people delay, they avoid, they wait until what could have been managed cheaply becomes catastrophic. This is not theoretical. Indian data is painfully clear. Wherever user fees have been introduced in public hospitals, utilization among the poor drops. In Haryana, hospital admissions fell by nearly a quarter after fees were introduced. Women, the poor, and marginalized communities are the first to disappear from the OPD queue. India already runs one of the cruelest healthcare models in the world when it comes to out-of-pocket spending. Nearly half of all health expenditure still comes directly from people's pockets. Every year, around 55 million Indians are pushed into poverty because someone in the family fell ill, not because they went to a five-star hospital, because they sought basic care. Government hospitals are supposed to be the shock absorber in this system. They are the thin line between illness and ruin. When you introduce charges there, you aren't recovering costs. You are transferring the risk downward onto those least equipped to bear it. And the contract with private hospital tells you exactly why this matters. An average hospitalization in a government facility costs a few thousand rupees. In a private hospital, it explodes to 7 times that amount. For the poor, the choice is not between public and private. The choice is between public or nothing. By turning free care into paid care, even at lower rates, the state is quietly saying this. If you are poor, your right to health is conditional. What makes this worse is that the same government had earlier invoked Article 21 to justify free treatment. The right to life, the right to health, big constitutional words. Now, without explanation, without a white paper, without an impact assessment, that right is quietly rolled back for the majority, while a protected elite remains insulated. If the argument was really about financial stress, there were obvious places to start. Maharashtra's legislators already enjoy state-funded medical insurance running into lakhs. Government employees have reimbursement schemes and cashless facilities. Judges and ministers have both income and institutional access that makes public hospitals redundant for them. Taxpayers already pay for their health security once. This policy makes them pay for it twice while being charged for their own treatment. And let's not pretend this is about saving the exchequer. If that were true, the first move would have been to cap reimbursements, rationalize VIP entitlements, and plug procurement leakages, or to increase health spending, which still hovers shamefully low as a share of GDP. Instead, the state chose the easiest target, the patient who cannot argue back. The result is a two-tier system inside the same hospital. One person walks in with an invisible exemption card. The other walks in with a bill counter waiting at the door. Same disease, same doctor, completely different moral universe. This flips the idea of equity on its head. In a fair system, those with greater ability to pay either pay more or step aside so resources flow to those who need them most. Maharashtra has done the reverse. It has socialized benefits for the powerful and individualized risk for the powerless, and the optics matter. When citizens see elected representatives accessing the best private care, often funded by the public, and then see the same representatives protected from paying even nominal fees in government hospitals, the message is unmistakable. Public health is not a right, it is a perk of office. This is how trust erodes. Not with one dramatic scandal, but with quiet decisions that tell people exactly where they stand. A fairer approach was possible. Free care could have been retained for the poor, the unorganized worker, the farmer, the urban informal class. Exemptions for high-income officials could have been scrapped without harming anyone. Graded fees based on ability to pay could have been explored. Data could have been released transparently. None of that happened. Instead, Maharashtra chose to protect symbolic privilege and monetize vulnerability. And that is why this decision isn't just bad economics, it is bad ethics. It is a reminder that when budgets tighten, the knife almost always moves towards the weakest, not the most comfortable. The tragedy is that illness does not check your designation before striking, but policy, it does. And this one has made its choice very clear. That's all on today's Honest Take with me, Tejas. If you found this story important, please share it, comment on it, and keep watching Lokmat Times for more in-depth analysis.